FM and Vibes Radio. In studio with us this morning, we have Dr. Ruby Blanc, who's the hospital medical director, and also the social services specialist, former PS Davis Later. Welcome to today's program, both of you.
Thank you.
Thank you.
And of course, we're broadcasting live on the YouTube and Facebook pages of the Office of the Prime Minister. So, for those of you tuned in via those mediums, welcome to you as well. Dr. Ruby Blanc, we're going to start with you this morning. Congratulations, first of all, to you and your team on doing such an exceptional job in on the front line in this battle. I know the hours have been tiring, but you all have committed to this and you have been putting in the work. So congratulations, great effort on your part.
Thank you, and good morning to all persons who are joining us for discussions this morning. Thank you for extending your appreciation. The one thing I must say is it has been very much a team effort. It's not really left up to just one or two persons. It's the combined efforts of all persons within the Ministry of Health. And also, we could not do it without the support of the public, because we may be able to give all of the directives, we may be able to do everything on our part, but if we did not have the support of the public, we would not be at this stage.
Definitely, most definitely. And, based on reports, we are seeing a lot of progress, a lot of recovery. And, of course, like Dr. Ahmed mentioned earlier this week, we are so far flattening the curve because of, like you said, the cooperation of the general public. However, our emphasis remains that we should not become complacent. And you are responsible for the hospital. And people seem to think that it's business as usual again. Tell us what protocols remain in place at the hospital and what should people expect when they go there?
Okay, so before we get to this point, if you would permit me, I would just like to give the public a little brief update on the patients that we do continue to have within the facilities.
Okay.
I'm sure, as everybody would be aware, we've had 16 persons who have been confirmed to have COVID-19. Happily, of these 9 of them have recovered and have been discharged home. At this point in time, we actually have no patients at the PMH, Dominica China Friendship Hospital, because the patients who were there have been discharged. They've met the criteria for discharge and have been sent home. So we would have 7 patients that are remaining admitted, and they are at the St. James unit in Portsmouth. I am also happy to report that these patients are essentially quite stable. In fact, most of them do not have any symptoms at all. And those who do have symptoms, the symptoms at this point in time are quite mild. And over the next few days, we will be doing retesting for these inpatients with the hope that the retest will be negative.
Right.
And if each patient, 2 tests are done at least 24 hours apart, and if both of those tests are negative, then those patients would have met the criteria for discharge and would be sent home. Okay, so I just wanted to give the public that little bit of an update.
All right, thank you for that. Dr. Blah, before you, with that update, let me ask you, you mentioned more about their physical health, but can you tell us more about how they're doing? If you are aware, I'm sure you've heard or you're in communication with them. What are their spirits like? You know what you've heard, even, and I'm sure you all are still in contact with those who have already recovered.
Oh, yes.
So tell us a little more about that. What is
So in terms of the people who are recovered, we don't just send them home and forget about them. They actually go into an additional 2 weeks of home quarantine, and the primary healthcare team is in contact with them, continuing to monitor them, both obviously their physical and their mental health. The patients at St. James are also stable from a mental health point of view. Obviously, in terms of a general report, some patients, it was a little more difficult to adjust for some rather than others. But I have to say we have taken a holistic approach to their health.
Right.
Not just in terms of giving medications, but we also have the mental health team assisting us and supporting us. So the patients were assessed from that point of view. And I know that the mental health team has actually had one on one sessions via Zoom
Mm-hmm.
with those patients to provide them with the necessary psychosocial support, that they would need to cope. So as I said, we're taking a holistic approach to care of these patients.
All right, that's fantastic, Dr. Black. Again, I really have to commend you all on dotting the I's and crossing the T's. A whole and this holistic approach. And every time we have a discussion or a press briefing, it becomes even more apparent how holistic this approach is. Last evening, for instance, we had the press briefing. Like the minister said, now we're incorporating the spiritual
Yes,
into
yes,
this, so the
yes.
mental, and that's why we have with us the social services specialist
Mhm,
here, Mr. Leta, who will speak. We will speak with him a little bit
mhm.
later on in the program to kind of hone in on that mental aspect, and what him and his colleagues are doing in support of the work that you all
Yes.
are doing.
Mhm.
So, Dr. Blah, back to you. We're talking
Right.
about the hospital now.
Okay, so going back now to your original question, we've discussed it a number of times, but I think at this point we certainly need to remind persons, the public, as to what we've put in place and what remains in place. I want everybody to remember the pandemic is still ongoing. It is still an active pandemic. And as I keep telling people, I believe right now we have two enemies. We have
Hmm.
COVID-19 and we have complacency.
Right.
People are likely to let their guards down because we've not had, thankfully, any new cases now for more than 2 weeks. But we cannot declare the war as having been won
Hmm.
at this time.
Hmm.
So at the hospital, one of the first things that we put in place was screening at the front gate. So at the main gate, when you would come in, you would meet a group of nurses under a tent right at the front of the gate. And at that point, they would take temperatures and they would also ask a few basic questions.
Hmm.
Most of those questions would be about whether there was any history of a fever, and other symptoms of flu, like shortness of breath, sore throat, ill feeling, tired feeling, any nausea, vomiting, runny nose,
Hmm.
questions along those lines.
Hmm.
Now, if there was elevated temperature or any of those other questions were a yes, then the patients would be directed to a second level of screening.
Hmm.
And that second level of screening is a container that we set up as a proper clinical space, that is kind of just a little bit to the side and behind of the old Alford ward.
Hmm.
And at that point, they would meet a doctor and a nurse there, and a more detailed clinical history would be taken, a detailed examination as is necessary would be done, and then
Hmm.
all of the necessary tests would be done, including if the person met the criteria for a suspect COVID, then they would also be swabbed at that point in time.
Okay, Dr. Blah, not to trip you, but you
Mm-hmm.
mentioned a container. And I'm going to say this because you hear all kinds of things in the
Mm-hmm.
public, and people start thinking that it's just one of those 40-foot containers that you just hauled from the port and you just set it down at the hospital.
No.
Tell us about the retrofitting of this container. What is inside? What have you done?
So essentially, if you would not have been able to see the outside of the container, you would never know that it was a container. The inside is set up like any standard clinic. Obviously, we've taken into consideration infection prevention
Hmm.
and control measures.
Hmm.
So it is set up also with a view to the privacy of the patient,
Right.
and all of the basic supplies that we need to run any clinic is there. Actually, we consider the container as an arm of the accident and emergency. It's just that it's providing a bit of a special service, rather than the general accident and emergency. So in no way must people think that it's little 2 by 4 place that they're just sent to.
Hmm.
It is a proper, well-established clinic setting where they are receiving the best care that we can provide.
All right.
Okay.
Fantastic.
So patients, as we said, would have gone to the second level of screening if it was indicated based on the screening at the front gate.
Hmm.
Obviously, if a patient came in and they did not have any indications that should get them directed to the screening container, then they would be sent to the regular accident and emergency for whatever additional care that they would need. Initially, this system actually worked quite well. There are a few initial teething pains, but I think we got things pretty much together in a very short space of time, and I really have to say thanks to the staff and all of the other people, the maintenance people, etc., who made this possible. But again, as I said, we're seeing a little bit of complacency slipping in, and we are beginning to get some resistance from the public. Persons don't want to stop and have their temperatures taken. Even some patients sometimes want to proceed directly to the regular A&E without, any of the screening being done. And obviously, this is defeating the whole purpose of having had the screening area be set up. And as we've said several times, at hospital we have sick people, and if they are exposed to COVID, their outcome is likely to be worse than somebody who is otherwise well.
Right.
And we want as much as possible to keep any active disease out of the normal clinical phases. We want any patients with COVID to be in a contained, controlled environment so that they are protected and other patients and other staff are protected. Now, I also want to point out that, as I mentioned before, staff are to be screened as well. The staff are actually, and we sent out all of the directives to them, supposed to do self-monitoring for all of the same symptoms, to check their temperatures 1 to 2 times a day. But when staff are reporting for whatever shifts, their temperature is also checked, because we do not want anybody to inadvertently, show up for work, go on the ward, be COVID positive, and essentially infected the entire ward. So the public needs to know it is not just they alone, that are exposed to the screening, but staff and visitors are also screened. Now, the other initiative or step we took in addition to the screening was that visiting was banned at the hospital.
Right.
And that is still in place. And it is for the very same reason we do not want persons from outside to bring COVID into or to infect persons who are already compromised due to other medical conditions. We are getting resistance again with this initiative. What we have said is you can bring supplies for your relatives. Obviously, you'll be screened at the front gate. Once everything is okay, you'll be allowed to proceed to the ward, where at the entrance of the ward, you will hand to the nurse whatever it is that you've brought in. So it's not as if you cannot bring provisions for your relatives or your friends, but you are not allowed onto the ward. And we've had some people who've really, really treated nurses very badly, have become very rude and unruly. What people need to understand is this is not just to protect the patient. You also can pick up things or get infected from things from the patients themselves. So it is also in your interest not to be within those clinical spaces. So we are pleading with the public, please, to work with us in terms of making themselves available for the screening at the gates, as well as to understand why we have restrictions on visits at the hospital. Another thing that we're seeing, people come to bring provisions for their relatives, and 5 or 6 persons show up on one vehicle. I mean, really, there's no need for this. You're not going to be, or you shouldn't be allowed on the ward. So even if there are other persons in the vehicle, there's no reason why you cannot just park in the parking lot, and one person who is able to get screened goes into the hospital, drops off the stuff and leaves. So that is something we also needed to to point out.
Of
Okay.
course.
The final major step that we took was the suspension of elective activities. So we are not at this point conducting any outpatient clinics, except the oncology clinic, which is obviously a very special group of patients. And we're not doing any elective or non-emergency surgeries. No, doesn't mean that the hospital is closed, and if people are sick, they cannot access care, obviously. A&E is still open and running, but we are requesting again that A&E is used only for true emergencies, life-threatening conditions, serious conditions. The health centers remain open, and they can be accessed for care as is necessary, and especially for persons with our chronic conditions, hypertension, diabetes, etc. The health centers are there, that blood pressures, blood sugars can be checked, prescriptions can be written and filled as is necessary. So patients should not sit at home and not take their high blood pressure medication or say that they've run out of it because they have nobody to take care of them. That is not the case. And of course, Ms. Harry, I'm sure you will also remind persons the hotlines are still available. And we again are encouraging persons with any fever and flu-like symptoms, please do not just show up at the hospital or the health centers. Call the hotlines and you will be directed as to what to do. If necessary, we will even send a team out to take care of you where the swabs need to be done, etc., etc. And again, we're trying to contain everything so we do not have one person infecting numerous people. So those are the steps that are taken. I know that persons must be wondering and asking, well, when are things going to go back to normal at the hospital? That is still obviously a question that cannot be answered in great detail at this point. It is something that we are looking at and reviewing every day. A number of factors play into that decision. Obviously, what is happening within the local setting, whether we end up with any, God forbid, any additional new cases. But what I can say, it is something that we are actively reviewing at every point, because we would want, as soon as is possible and is safe, for us to resume activities. Having said that, I can tell the public right now that it will not be business as usual, and I think we should all make up our mind or accept the concept of the new normal.
Yes.
So when we do reopen, at whatever point that is, in terms of, when I say reopen, know that I'm speaking about elective non-emergency activities. When we do restart, we will obviously have to put certain things in place that may not have existed before. We probably would not probably, we will not be able to have 20 people sitting in close proximity, to each other. People will obviously have to wear their masks. And I mean, those are just two I am throwing out. But we will direct the public as to the do's and don'ts. And it is all at the end of the day to protect, yes, our staff, but it's also to protect our patients, both in and out patients.
All right. Thank you so much, Dr. Ruby Blanc, Hospital Medical Director. Again, that's a lot of information to absorb, but the key here is just to follow the directives. When you get there, if you just follow the directives being given by the nurses or security or whoever is the first person you come in contact with, then there shouldn't be any real difficulty. Again, visitation is being limited at the hospital. And you mentioned having 6 people in the vehicle. It's not even just about how many can come into the hospital. You are already putting yourself in danger having so many people in the one vehicle, considering we should be practicing physical distancing. So that is already a no-no, so to speak, before you even get to the hospital setting. So you're already putting yourself at risk. So again, we are encouraging people to continue practicing all the protocols or the measures that we have been encouraging for the past few months, because that is how we have been able to keep our numbers down, or keep us at 16. And we, like Dr. Blanc says, 9 of them fully recovered, and the others were just awaiting their retesting results, and hopefully we'll be able to send them home. Like I mentioned before, we do have Mr. Davis later. Mr. Later, we did not forget about you. And, you are here. And We're talking social services. What is your role in this battle, Mr. Lita?
Okay, my role in this battle. Well, just before I talk about my role in this battle, I want to commend the Ministry of Health, Dr. Blah, and a team, and by extension, the government of the Commonwealth of Dominica, for this tremendous response that we've seen towards containment of the COVID-19 situation in Dominica. It's certainly very commendable, Dr. Blah, and I would like you to convey my comments
Thank you.
to the rest of your staff. I've always maintained that the Ministry of Health is one of those ministries in government where you find some very highly committed staff, very dedicated to what they do. So I must commend the Ministry of Health and also the other ministries that engage in first responders like the national security, of course, the police, the fire, and the others who have been on the front line. It certainly tells us, like you said, that when we work together as a team, irrespective health or multidisciplinary, how much we are able to accomplish. And I must say, COVID-19 has given us an opportunity to do just that. In terms of social services. Well, as you said, currently assigned to the ministry responsible for welfare, working with the welfare division more in the area of institutional strengthening, looking at some of the systems and processes and how we can improve on our services to clients. The welfare division has continued its services to the Dominican public. Services of welfare has never stopped, although in perhaps a limited way in terms of the number of clients that can be seen at the office at any one time. Those services continue. I know too that in response, that just recently, the Welfare Division, as in collaboration with the Bureau of Gender Affairs, has started a program looking at areas of psychosocial support to the Dominican public, and of course the officers, the counselors, and the other social workers there continue to interface with their clients through the various means that are available. Dr. Blanc earlier mentioned about the use of Zoom in counseling, WhatsApp also. So the officers have been very creative in trying to reach their clients with whatever the situation is at this time.
Now, so we're talking psychosocial support. And we know that in times of stress and anxiety, that is especially needed. So how would the welfare division, what support, let's be more precise, what support is being offered? Are there therapists that we can speak to? Even those who are just very scared about the aftermath of this, because in the aftermath there's a lot, like Dr. Blanc said, a new normal people have to get used to. There's a lot of anxiety surrounding that. People are afraid. So what support exactly is being provided?
Well, at the welfare division, there is a professionally trained counselor. There are also other staff members who are trained in counseling who are available to clients, to the Dominican public. But we don't only have counselors in the welfare division. Fortunately for us in Dominica, we have counselors in other areas. For example, in the Ministry of Education, you have a number of school counselors who make their services available to children in the schools. I know in the Ministry of Health, there is also a counselor more assigned to HIV/AIDS, but there are other counselors within the system. As you said, this is a period of high emotion, and many people just want to reach someone to talk to. So these individuals make themselves available to the public using whatever means available to them to listen, importantly, listen to what their fears are, listen to, the emotions that they're going through, and to offer some level of support. Additionally, I also know that the Youth Development Division has provided some level of counseling service. Actually, the Youth Development Division has been engaged in training a number of lay counselors, I must say, across the island.
Okay.
And some of those people, because sometimes an individual may be in a crisis situation and can't find a professional counselor. And, but you can find an individual who you could just talk to. And that can help to allay your anxiety, allay your fears about that particular situation. And I know that over the years, the Youth Development Division has trained quite a number of its youth leaders and other community leaders in that particular area. So this is an opportunity too for some of those people to come forward and utilize the skills that they have acquired over the period.
All right. Now, there, like you mentioned, lots of different services are available at the welfare division in your department. And lots of people are concerned with even things like housing. Even people who might not have the resources that everybody else have, the bare necessities that everybody else have. What can you do for those people? What support can you offer to them?
Okay, at the welfare division, the public assistance program (PAP) is one of the flagship programs of government, social protection program of government. And that program seeks to address the needs of the most vulnerable population in the country. The division works very closely with the Ministry of Housing in trying to address more particularly the housing needs, because under the public assistance program, the resources that we provide, that mainly goes towards support, family support. And but housing, the officers work very closely with the Ministry of Housing or other organizations to try to address the housing needs. Increasingly, we recognize that holistic approach needs to be used towards providing care for the clients who come before us at the welfare division, and therefore there is need for us to engage with other stakeholders, for example, health, because you cannot deal with an individual to compartmentalize so much, while we all have our specific roles to play. But when you come when you come to interface with that individual, you need to recognize what are his needs, and your agency may not be able to provide all the needs that that the individual has at this point in time, but it is your responsibility as the caseworker to try to mobilize the resources from the other agencies, other agencies, be it in government, non-government, that can help to address the need of that individual. Within the welfare division now, and in social services too, there is now a greater focus on case management. So in managing those cases, that we try to take on a multidisciplinary approach. So if we recognize that this person has a mental issue, we would engage the mental health professionals in that area. As I mentioned earlier on, if it's housing, if it's an employment problem, for example, I know the welfare division has been working very closely with the NEP, the Youth Development Division, and other agencies that are involved in this. At the end of the day, the goal is really to improve the social functioning of this individual as best as you possibly can. So you need to mobilize the resources from wherever it is available in order to do that.
All right. Thank you so much, Mr. Leta. The numbers to call, of course, let's open up the phone lines for questions and comments. 1-800-327-448-3284. 449-8719, 616-1327, and of course the overseas line 305-432-9744. Give us a call if you'd like to ask Dr. Blom, Mr. Leta, a question, or just make a contribution to today's discussion. Dr. Blah, back to you. Let's talk a little bit about staff morale. Because we focus so much on how we can encourage and support the general public, but how would you describe staff morale?
I will be very honest with you. The staff, for most part, have been just really going above and beyond. They have given and are continuing to give. And what persons must understand, medical personnel, doctors, nurses, everyone who works at the hospital, they're human beings. They have the same fears and concerns that everybody else has. And yet still, the majority of people came forward and did what they were supposed to do. Initially, as I said, we had quite a bit of fear, concern. We did some sessions in terms of psychosocial support for the staff to give them some coping tools. Since the two units are open, that's the two isolation units in Portsmouth and at PMH were open, they actually had sessions with the mental health team because this is obviously an extremely high stress area because they're taking care of patients who've been confirmed with with COVID. They themselves are being quarantined, so they're away from their, family and what would be their usual support system and support base. So we have provided some psychosocial support, and that is coordinated by our mental health team. We continue to do, I guess, some degree of one-on-one for the various heads of department. Through myself, we pretty much have an open door policy. So if an officer has an issue, and that's just not for myself, but for the other levels of staff, the nurses, the other support staff. So if there are issues, that they can come and talk to us, and we obviously try to get what is the best solution. Obviously, you always have some who have not necessarily done what they were supposed to do, but I have to say those are for most part in the minority, and we've really seen a lot of teamwork. I think the last time we had this type of cohesiveness was just after the hurricane. And I am extremely proud, specifically of the officers that I supervise and more generally the staff. Not just at the hospital, but within primary health care. I mean, let me tell you, at the height of this, we were pulling some hours that it was just, and you would ask people and they would say yes. Some you would need to give a little explanation, but then they would say yes. And I think, persons are probably a little bit tired now, so we are really hoping that the numbers stay as they are.
Definitely.
And so it will allow a little bit of time for persons to, I guess, for want of a better word, regenerate, relax, kind of get themselves back together. But really, it's hats off to the staff.
All right, we have our first caller on the line. Caller, you're live. Go ahead.
Hello, good morning.
Yes, good morning,
Good
caller.
morning.
Yeah, congratulations to you all, and it's good that we are at that stage. I have two questions for Dr. Blah, maybe three. The first one is, can high sugar intake when healthy contribute to the development of diabetes? That's my first question. Second question is, does frequent consumption of chemically preserved foods have a link with developing hypertension? Third is, how much would a COVID test cost to the public? I'm not talking about now. I'm thinking going forward. Just as we have a planned quarantine program, as we know, COVID, the virus, was imported. It came from outside. So when we have reached that place where we are sure that it is not on island, and we are considering opening our borders again, we should have a program whereby people can be certified at the point of entry. Not certified at the point of entry, before they leave where they live in. So they come with some sort of proof of having been tested, having been through quarantine before they left to come to Dominica. Because we still have to be very vigilant in protecting our borders, in keeping it out. Because there is a cost associated with getting, preventing the population from being infected. So somehow that cost has to be shifted to the people who would want to come here. So I would like a feedback from you, but I want to know how much of the cost. Thank you very much.
All right, thank you, caller.
Okay, thank you. I believe the first question was high sugar consumption, whether it
Yes.
contributed to development of diabetes.
Yes.
Okay, and the answer is yes. For persons to develop diabetes, usually there are two factors. Your genetics, how you're born, what you've inherited from your parents, and then there's the environment. And environment would obviously be, among other things, what you eat. And so if you already have a genetic predisposition and you're not eating properly, then obviously your chances of developing diabetes is significantly increased. Having said that, even if you may not have any kind of genetic risk, if you are not taking care of yourself, not eating properly, not exercising, there's also an increased risk of developing diabetes. And yes, processed foods, because many of those, the issue with them is that they have a high sodium content. And that is one of the major drivers in terms of developing of hypertension. COVID-19 is obviously a public health issue. And so to date, we've not had patients or the public having to pay for tests, because it is critical, if we are to get a hold on this condition, that all necessary testing is done. And at this point, cost can be prohibitive, meaning that it can make some people not be able to get the test, although they need it. So at this point, there is no cost. And you've heard on the news all of the various friendly governments and organizations who've assisted us in building up our testing capacity, both through training as well as through supplies, etc. Yes, we have to look down the line, and as you said, one of the things maybe that may have to be put in place when our ports are reopened. We may need to look at certification from people coming in. Have they tested recently for the test? Are those tests? What is the status? We may have to consider if persons cannot come in with proof that they're negative, of us offering those tests, from the ports of entries, that maybe we would quarantine people, get them tested. And certainly we have to think about sustainability of those types of services. And obviously, a major part of sustainability is cost of materials, cost of human resource, etc. So yes, it is not beyond reason to think that at some point down the line, that is a question that has to be examined and obviously answered. The good thing, we know that tests are in great demand all over the world, but just looking at basic economics, after a while, when the demand starts to fall and we have more production, then unit costs will also fall. So while I don't have an exact figure that I can quote, it pretty much stands to reason that with the passage of time, what the cost of a test is right now, will very likely, that cost will be lessened as we move along. Okay.
All right. Thank you so much, Dr. Blanc. The phone lines are open. Once again, 1-800-327-448-3284, 449-8719-616-1327. Or for those of you in the diaspora tuning in, 305-432-9744. Mr. Later, a question to you. A while back, we had Miss Leslie Ann Waldron on with us, and, she's a psychologist, and we were speaking about coping mechanisms, and that is still of grave concern to us. What methods can people use to cope? Because like Dr. Blah mentioned very early on, the support systems that we are used to are not available anymore. The domino playing, or the going and just hanging out at the bar, or even for some people like the frontliners being with their family. Those things are no longer available. Let's talk about the coping mechanisms a little bit.
Well, the coping mechanism, I agree with you, maybe because of social distancing, physical distancing, that some of those systems may just not be in place yet. But this is a good time for us to go back to the family, because you can play dominoes with your family. You can do many things with your family. This morning I was listening to the Minister of Education talking about the platforms that are available for e-learning. And when I listened to her, what I saw is that with this new platform for new learning, what this essentially does, it brings families closer together. Because parents now, where they don't have, they don't have online service, have to go and pick up the assignments for their student, for their children, and then guide the children as best as they can. So this provides an excellent opportunity now for families to bond. Yes, we have the situation of the healthcare workers who many of them have to be out. And I was happy when I heard Dr. Blanc make mention of the psychosocial support that is available to the healthcare workers, because we always have to be mindful of the care for those who care, and I'm very happy that this is one of the areas that is being addressed. But to go back to the family, because this, to me, we've always promoted the family as the basic unit of society, and the family being around which everything revolves.
Right.
And I think COVID has given us an excellent opportunity to just prove that. The other thing, so the family role, in a sense, with COVID is sort of strengthened, because, for example, you have a birthday party, you cannot invite your friends to come, but you can celebrate it as nice with your family at home. You can put on your music and dance and just do the things that you would normally do at a birthday party. I mean, if you want to extend it further and wish to invite your friends, then you can use the available technology, and you can have your birthday party on Zoom.
Right.
So a lot of people have been sharing those things with me, that they had their Easter lunch, their birthday party, and those kind of things using the technology, and how well it has worked for them.
Right.
So this is available. In addition to that, just the traditional calling of friends and family. That is so very important, particularly our elderly who are maybe home alone. A
Right.
lot of elderly people who live, who live alone, and at this particular time, it's not being encouraged for them to go out there. So we can occasionally call those individuals to provide some kind of emotional, social support. So these are ways, call our friends. I have been hearing the various sporting associations talking about what can be done by the membership during that time of quarantine, that time of lockdown, so that they can still be active, still exercise, still do certain things. Because one of the things we have to recognize, as Dr. Blanc said, while it's a new normal, and in this new normal, that there are certain essentials that we still need to carry on with in order that we can stay healthy. So these are some of the things that we can do to cope. We have a lot more time maybe on our hands now, and a lot of us, we spend a lot more time at home, so we can really make good use of that time. Maybe it's an opportunity that we had longed for a very long time, to be able to spend that quality time with family. So why not use it, as Dr. Blanc, and I heard Dr. Esprit in one of her presentations talking about that. We should really use that opportunity that we have now to essentially regenerate ourselves. Physically, spiritually, mentally, and otherwise. As I speak spiritually, even I know a lot of the faithful, they may be missing out on the church services, but there are a lot of online things happening now. I was just reflecting on a posting that someone sent me a couple of days ago, and there was the devil coming in high smiles to Jesus and telling him, well, all your churches are closed now, and the response was, well, the churches may be closed, but million others have been opened.
Yeah.
Because the family really is the domestic church. And what we see happening with COVID is that more families are using that opportunity to pray together. This is really church alive,
Right.
bringing the church into family. So these are a lot of the things that can be done to cope with the situation. Let's thank God for family.
Yes, definitely. Thank you so much for that, Mr. Later. I know the phone lines were ringing off the hook a second ago, but we're getting very close to the end of the program for today, unfortunately. Again, let me remind everyone that the hotline operators are still available to assist. And of course, we encourage people not to abuse the hotline. But if you have a genuine concern, the COVID-19 hotline numbers 448-2151, 448-2153, 448-2156, 611-4325, and 1-800-219. Let's take this next caller. Caller, you're live. Go ahead.
Hello, good morning, and congratulations to the doctor and the social worker. Absolutely wonderful. There's a question I want to ask as regards manifestation. I saw a report by the American Academy of Dermatology, and they talked about COVID toes, purple swollen toes that look as if they have been frostbitten. And they were saying that this may be the latest indication of a coronavirus infection. Has that been manifested or observed here on the island of Dominica?
Okay, thank you very much for this question. COVID is evolving. It's an ever-changing face. Every single day, there are new reports of possible new symptoms, new manifestations. And like you, I am aware of the dermatological changes that they are believing are probably associated with COVID. At this point in time, we've not seen any persons showing up, certainly not among those we've had who've tested positive with those specific manifestations. We have what we call in medicine anecdotal cases, one or two or a small group, and it may not be something that is seen in a larger part of the population. That is also something we have to keep at the back of our mind. Sometimes we have other things causing one problem, but because it's in a patient who has COVID, we're not quite sure if it's the other thing or if it is COVID itself causing it. Some of those answers simply will be obtained with the passage of time. As we learn more and more of this condition, as we see how people present, as we're able, in a sense, to compare information. What are the Europeans seeing? What are the Americans seeing? What did they see in China, etc., etc. We will be able to come up with a clearer picture. But medically, it is still pretty murky waters because, as I said, we're finding out every single day something new about this virus.
All right. Now, Dr. Bala, as we're speaking about the symptoms, let's talk a little bit about those who are asymptomatic, though. Because when we talk complacency, when we talk about being vigilant, that's something we have to take into concern as well, that there may be individuals who show no signs and symptoms.
Actually, that is probably the most concerning part about COVID. It's fairly simple. Somebody has symptoms, you test them, you find out whether they're positive or whether they're negative. In a simplistic way, problem solve. But for the asymptomatic persons, they're walking around very healthy, no signs at all. Obviously, that's what we mean by asymptomatic, and yet still they are able to pass on the condition. In terms of our initial response, it's all of the things that we're promoting: the hand hygiene, the cough etiquette, the physical distancing, and very much the wearing of masks. We cannot overemphasize the wearing of masks. It may have come on board a little later than some of the other steps that we've been pushing, and that's not just locally but internationally. But one of the main advantages of wearing a mask is not just that you can it prevents you from infecting somebody else, just in the event that you are carrying the virus, you are shedding the virus, but you don't have any symptoms. If you have your mask on, it significantly decreases the chances of you passing on that virus to anybody else. And if two people wear their masks, I mean, the chances of spread of contaminating either way is significantly reduced. So at this point, that's what is within our power to do, and that's what we must do. So that is a very effective way of dealing with patients who may be asymptomatic. We're all protected, via those means. There is also what you call active surveillance, and those are all of the things that we eventually, as a health service, will have to look at. In terms of going out and doing some degree of random testing, so we can find maybe what is the level of asymptomatic patients within the general population, and that might be very helpful moving forward and making some, health related decisions. But as I said, what we can do at this point are all of the things that we've kept on promoting and pushing: hand hygiene, the cough etiquette, physical distancing, and the wearing of masks.
All right. Thank you so much for that, Dr. Blanc. We are about at the end of today's program, so let me quickly have both of you give some final comments. Let's start with you, Mr. Leta. What would you like to leave with our listening public?
Well, in terms of what I would like to leave with the listening public, first, I just want again to commend you, Ms. Harry, and the rest of the team at the Ministry of Health, and as I said, by extension, government, for the excellent job that we've done in order to contain the virus in Dominica. And I mean, let us not go back on the gains that we have made, but let us pay very much attention to the advice that is being given out there by the officials of the Ministry of Health, as Dr. Blanc indicated. And I think the point that I would like to leave with all listeners is that the responsibility is on each of us. Right. It's not just on the healthcare professionals or on government, because the healthcare professionals may do the best that they can, have the best systems at the hospital and at our health center to try to respond to the situation. But unless we cooperate with them, and it was sort of disheartening to hear some of the reaction Dr. Blanc mentioned, that they have to contend with certain not. The majority, of course, but some people from the public, that we're hoping that we can desist from those behaviors, because, as I will reiterate, the onus is on each and every one of us to keep Dominica COVID-free. Thank you very much, and it was a pleasure to be on your program today.
Thank you so much, Mr. Leta, for joining us. And how about you, Dr. Blanc?
Right. So, of course, I would like to end by saying thanks for this invitation. And Ms. Harry, you have done and are continuing to do an excellent job.
Thank you very much, Dr.
I really also need to extend my thanks to the Ministry of Health as a whole. The minister has been providing excellent leadership, all levels of administration, clinical, and support staff. I will not begin to name particular areas or departments, because, as I said, it is really a team effort. The other ministries that support the Ministry of Health, in what we do, we would not be able to function without them. And as we mentioned at the beginning, and as Mr. Leta also pointed out, the public. This is a fight that we are in together. We cannot do it without you. Let us not let complacency get the better of us. Let us continue to take care of ourselves, our physical selves, our emotional, mental, and spiritual selves. All of the practices, I know we sound like broken records, but I fully believe that it is a major reason why we are at this point and not in a worse situation. Hand hygiene, cough etiquette, physical distancing, wearing of masks. I mean, I don't go out very much, but I still see people simply being too close to each other.
Yes.
Driving to DBS, there were far too many people walking around in fairly close proximity wearing no mask. Okay, and we really, really cannot let our guard down. As I said, the war has not yet been won. So please let us continue to work together. Let us not become complacent, but let us remain hopeful that with our combined efforts that we will prevail and we will be successful in beating this disease.
All right, Dr. Blunt, excellently wrapped up today's program. Again, we're stressing just compliance to the protocols. You know, Dr. Bland, her team working so hard at the hospital. So for those of you who have to go there, just pay attention, follow the directives, and let's keep each other safe. Let's care enough about each other. Because like she said, asymptomatic people, you can spread COVID. And you don't know how my body will react to it. So if you care about me as my loved one, as my family, as my friend, let's care enough about each other to just follow those directives and practice those precautionary measures. Thank you all for tuning in. Thanks to the listeners of DBS Radio, Voice of Life Radio, Kyrie FM, Q95, and Vibes Radio, as always, for listening. And we'll be with you, God willing, on Monday again for another program, another COVID-19 discussion. Have a great day, everybody.
Thank you. Bye-bye.